NexoBrid, the innovative enzymatic debridement. The pharmaceutical product NexoBrid from Mediwound has proven efficacy in the enzymatic removal of burned tissue in deep partial and full-thickness burns. NexoBrid is a concentrate of proteolytic enzymes enriched with bromelain from the strain of Ananas camosus. It was approved in Europe in 2012. Since then, NexoBrid became a standard of care treatment option for debridement of burn wounds in many European burn centers. Selective enzymatic debridement preserves dermis, which is considered to be extremely important for tissue regeneration. In this context, enzymatic debridement represents an ideal tool for a regenerative approach in the treatment of burns. Enzymatic debridement has also led to a paradigm shift in the surgical approach, whereby wounds are treated in a gentler and more selective manner. The patient has a very significant benefit from the fact that areas that were perhaps previously considered to be rather deep do not appear so deep in the end after selective debridement. Under certain circumstances, the wounds can heal spontaneously, which naturally results in fewer split skin grafts and thus less donor site morbidity. Enzymatic debridement has proved to be helpful in many ways in recent years, especially with regard to OR capacity. We can plan resources more independently. It provides us with diagnostic information about the burn depth, and in the case of patients with severe burns, it expands our therapeutic armamentarium. In the field of burn medicine, enzymatic debridement has strongly influenced interdisciplinarity and interprofessionality in recent years. The allocation of the different work steps between various specialist disciplines has strongly supported work processes and agreements, and the transfer of responsibilities results in better team cohesion. The exchange of experience on a European level, so-named consensus, is extremely important for enzymatic debridement, because on the one hand, working processes can be adapted and optimized based on this exchange. And also, mistakes in the beginning can be avoided, which is extremely important. For example, when the product is launched on the US market in the future. Yes, the future of enzymatic debridement is very exciting. On the one hand, in burns, we have to wait and see as soon as the product is approved for the treatment of children. Here, I see a very large potential. But of course also for the chronic wound, a very broad field where enzymatic debridement can be revolutionized. Fast, effective, selective. NexoBrid by Mediwound.